Hi, my name is Ben. I'll be the student nurse for today, okay? So I'm from first semester.
Oh, I don't want a student today.
What is going on, everyone? Welcome to Mint.
My name is Miko.
My name is Ben.
My name is Natalia.
And my name is Don. Today we're going to talk about survival tips for clinicals. So I don't know about you guys, but I remember the very first clinical day that I had. The night before, I couldn't sleep. I was anxious. I was very nervous. I was in a nervous wreck. Right, so for you out there, whatever you're feeling right now, that's completely normal. That is why we're here to give you some tips. Alright, so the very first tip that I'm going to give you is preparation. When I talk about preparation, I'm not just talking about preparing your stethoscope, your pen line. When I say preparation, I'm talking about what you do 2 days or a day before your actual clinical day. Usually, you know what floor you're going to for your clinicals. For example, you're going to the orthopedic floor. Open your books, read about hip replacement, hip fracture, knee replacement, read upon intervention that you're going to do, read upon possible complications, the worst case scenario that you will be facing the next day. In general, read about assessments, read about intervention, possible complications, and very important, read upon IV fluids. We're not talking about an all-nighter here. You're just pretty much keeping your notes and just anticipating what kind of patients you will be having for your clinical day. That being said, leave room for flexibility because sometimes the next day there will be some assignment changes. You're not going to be in your unit where you're assigned. So just be flexible. Nurses are flexible.
Thank you, Don.
You're welcome.
The next tip that I'll tell you guys is one of the most important things that you have to do before going to clinicals, and that is get some sleep. You have to have at least 6 to 7 hours of sleep the night before clinicals.
We know that's not usually the case, but Ben, that's the goal, right?
Yeah, so try. The last thing you want is going to clinicals feeling tired, feeling groggy, and if you don't get enough sleep, you won't be able to remember all the things that you studied the night before. Since you're waking up early, another tip would be going to your clinical site early. I'd say about 15 to 20 minutes early. In that way, you'll be showing your clinical instructor that you're punctual and you're professional. Also, it gives you time to prepare for your assignments.
Thank you, Ben. So the next tip is about supplies that you will need in clinicals.
You should prepare all your nursing supplies the night before your clinicals. This is to avoid panicking in the morning and to ensure that you will not forget anything that you will need.
Oh my god, I'm late for clinicals and I can't find my stethoscope. Can you borrow your stethoscope? Please, I have an alcohol pad.
So, here are the things that you should prepare, starting with your uniform. Make sure it is clean and ironed so that you will look professional. If your uniform is white, please wear beige undergarment. Seriously, no prints please, and we hope you know why. For your shoes, choose something that is comfortable. Remember, cute shoes do not mean comfy shoes. Don't get fooled. Don't ever forget your ID badge because without it, there is no way people can identify you as a nurse or a nursing student. You need your wristwatch to keep track of time. Make sure it has a second hand because you'll need it for measuring heart rate and respiratory rate. It is best to have a 24-hour analog dial since nursing documentation uses military time. Also, we suggest that you use a wristwatch with expandable band so that you can easily slide it up to get it out of the way whenever you are going to wash your hands. For your stethoscope, it doesn't need to be fancy like this one. As long as it has a bell, a diaphragm, and of course you can hear through it, then it works. Just make sure you have your name on it. Next is a pocket organizer. It is not required but it is nice to have. You will have quick access to your supplies and you can easily move your things to your next uniform. A clipboard so that you will always have an access to a writing surface. But take note, clipboards can be a foamite, so keep it clean. Multicolored clicky pen, my favorite. You will lose pen caps, so it is better to have these clicky pens. Also, it is nice to have different colors so that when you are taking down notes, you can write in several colors. For example, use black for the information you gathered during change of shift. Use blue for your own assessment or change of condition. Red for critical values. And green for the things that you need to do. This is very helpful in organizing your notes and keeping yourself on track.
How's the patient's blood pressure?
It is around 120/60 during night shift, but on my shift, it has gone up to 140/85. You'll need a pen light for checking pupils, looking at the mouth or nose. It is better to have a pupil gauge for reference. Scissors. You never know when you're gonna need it, so keep it handy. The brain, aka folded blank sheets of paper or S-bar form. You'll need it for taking down notes. Don't ever lose it. Drug reference book, quick reference ID cards, or medical resource apps such as Medscape. It is very helpful to have a resource available at hand. Of course, a stain remover pen for those times when you accidentally spilled over your coffee to your uniform. Also, don't forget to bring your bottled water and snacks. Keep yourself hydrated and energized. Do not be at risk for fluid volume deficit and imbalanced nutrition.
Hey, thanks Natalia for that supply tips for clinicals. Next, I'm going to be talking about the attitudes towards the clinical setting. Basically, for me, it's all about my emotions. The supplies and preparation definitely helps, but what that helps you with is to decrease the emotions you have before clinicals. Going to clinicals, it's scary. And anything can go wrong. But you're imagining going there, your nurse is scary, doesn't want to work with you, your patient has a lot of diagnosis, you may have to give an enema, and you may not know how to give an enema, and also your patient may code. You're going to be really stressed before clinicals, during clinicals, and the second until your clinical finishes. And this is normal, okay? You guys think this is normal for everyone as well? Yeah. So basically, you're going to be stressed, and how we're going to fix this is how you react to the stressor. Because everyone's stressed, and this is all about how you react to it. The last things we're going to give you some tips to help you decrease your anxiety during clinicals. Number one is that keep your routine before going to clinicals. For example, for me, I drink a lot of coffee. So this is not the time for me to stop drinking coffee, or else I'll be going through withdrawals or whatnot and get headaches. Anyone else have any routines?
Yeah, you are a coffee drinker, I'm not a coffee drinker, so I have a different reaction when it comes to caffeine. I get tremors. So if you're like me, then don't drink any caffeine because you're gonna give injections.
Yeah. And you're like, So the second thing we're gonna tell you is that to go to clinicals with the can-do and will-do attitude. For example, if a nurse tells you, oh, can you put an IV on my patient, and you don't know the patient, just go ahead and do it. Has anyone done anything else?
Yeah, be enthusiastic.
Yeah, exactly. Number 3 is to, when you don't know something or if you need something, just ask questions. Don, I believe someone told you that?
Yeah, I'm not going to take credit for this. Actually, an instructor of us told us about this mentality. Shout out to Mr. Parachi. He said that if you need something, just ask. If you need to do a procedure, if you need to do a care plan for a patient, just ask. So because a lot of students are very hesitant to ask their nurses, thinking, oh, she might think I'm incompetent or I don't know anything. Yeah, so just ask because nothing's going to happen to you. What's the worst thing that they can say? No. Okay.
Then when that happens, they can always ask another nurse. So
exactly. Just come in knowing that you're a student. Expectations are not going to be that high. No one's gonna know you can do heart surgery. No one's gonna know you can put IV really quickly. So number 4 is to come in and be confident. Imagine being the patient on the bed. Your student nurse comes in and it seems like they're not that confident. It seems like they don't know what they're doing, right? And it's hard. You can't trust them very well.
Fake it till you make it.
Yeah. And number 5 is you want to remain in control during clinicals. One of the things that I think Natalia told you to bring was a piece of paper that's folded up, and that's going to be your nursing brain. So you're going to stay on top of things by writing every single thing down. One of the anxieties in clinical is if someone asks you something about your patient and you don't know anything about it, it's hard to memorize things. So in order to know something, write it down. Write down the time, write down the levels, write down when you did this, write down when you gave the medication.
And also the color-coded pens, visually, you're gonna think fast because you'll see it right away.
Okay, so I've given you some around 5 tips to help you decrease your anxiety before clinical.
To sum it all up, do your preparation a day or 2 before your clinical day. Read your books, anticipate your patients.
Remember to get some sleep, set up your alarm, and be there early. Remember this, early is on time is late, and late is left behind.
And make sure you prepare all your supplies the night before.
Remember to ask questions, be confident, and use your brain.
Just remember, guys, that the roller coaster of emotions might not go away, and that's completely normal.
These tips should help you prepare for your clinicals.
Once again, my name is Miko.
My name is Ben.
My name is Natalia.
My name is Don.
Mid, signing out.